Hello everyone, I am Nishimoto, a resident in Saitama Medical University Hospital, Department of Urology from Japan. I'm going to talk about female Detrusor underactivity diagnosed by non-UDS evaluation. I'm very happy to make our presentation in ICS 2021. Introduction 1. Detrusor underactivity is one of the etiologic factors of female LUTS. Even though no definite standardized urodynamics criteria of DU have been defined in women, urodynamic evaluation, including a pressure flow study, is invasive nature and may give discomfort for the patients. Therefore, UDS is not a routine method for evaluation of LUTS. Introduction to several trials of non-urodynamic diagnosis criteria of DU has been examined. Recently, Japanese Consistent Society has published the non-UDS criteria for DU. This clinical diagnosis criterion for DU as follows. 1. Symptom complex of underactive bladder. In particular, the voiding symptoms of slow stream, hesitancy, and straining to void, and often reduces sensation of filling. 2. Qmax less than 12 and a PBR more than 100 milliliters. 3. Bladder voiding efficiency less than 90%. 4. Absence of significant pelvic organ purpose, cystocell with equal to and less than grade 2. Exclusion criteria were neurologic disease and other clear blue condition, such as a urethral stricture. Aim. The aim of this study was to investigate the non-urodynamic DU criteria comparing with UDS criteria of DU and bladder outlet obstruction. Method. Retrospectively, female patients with DU were selected from our UDS database in last 5 years. The patient with DU was selected by non-UDS criteria as mentioned. These selected DU patients were further stratified according to the 4 UDS criteria for DU: John, Abarbanel, Yami, and Griffiths. To investigate the presence of BOO in the DU patient, these DU patients were also further stratified by the 4 UDS criteria of BOO: Limac, Core, Solomon, and Gami. The result of non-UDS diagnosis for DU was compared with the result of UDS diagnosis for DU and BOO. For UDS criteria for DU, I'm making a graph showing pitted Qmax in the x-axis and Qmax in the y-axis, like a Schaefer nomogram for male. For the region defined by John, Abarbanel, Yami, and Griffiths was override in a Schaefer nomogram. In this way, every categorized region overlap each other. For UDS criteria for BOO, like at the previous slide, for BOO region defined by Limac, Cure, Yami, and Solomon was overlaid in a Schaefer nomogram. Every BOO categorized region overlap each other like DU criteria region. Result 1. DU proportion. As a result, only 16 patients, mean age 69.8 plus or minus 10.7, was selected using non-UDS DU criteria for our UDS database. Number equal 803. In these 16 patients, 43 of Detrusor overactivity were found. Proportion of UD were low, 0 to 38%, using 4 UDS criteria for DU. Result 2. BOO proportion. 25 to 88% of BOO patients were found. except GAMI criteria 0%, using for UDS PU criteria. Non-UDS criteria diagnosis for DU may not be described between DU and PU. Interpretation of research. Disagreement between DU diagnosed by non-UDS and the UDS diagnosed criteria cannot be ignored. Even though non-UDS criteria may be suitable because of no invasiveness for patients, its accuracy for DU diagnosis may be unsure. On the other point, no established urodynamic criteria for DU are also an urgent issue. This study is exceedingly small and has limitations. More large study is necessary to confirm these results. Concluding message. In conclusion, non-UDS criteria for female detrusor underactivity may have big power to discriminate between DU and PU. Non-UDS criteria for DU diagnosis should be carefully used for its accuracy. We may need more refined non-UDS criteria for female underactive bladder. Thank you very much for your attention. I'm very happy to have any question from audience.